Good afternoon,
So
everyone. Pediatric Center of Excellence, Kalavati Saran Children's Hospital, New Delhi, welcomes all the participants for today's RDLS session. The topic covered today is screening and management of sexually transmitted infections and reproductive tract infections, that is STIs and RTIs. And the speaker is Dr. Neha Gaur. Dr. Neha Gaur, ma'am, is working as a senior medical officer with the Pediatric Center of Excellence at Kalavati Saran Children's Hospital, New Delhi. We welcome you, ma'am, for today's session and request you to start the session.
thank you, Shweta, for the introduction. So good afternoon, everyone. I'm Dr. Neha Gaur, and today's topic is screening and management of sexually transmitted infections and reproductive tract infections. Just give me a second, please. Actually, I need to move this sidebar. Just give me a second. Headaches.
Ma'am, it's not appearing with click. If you click on the slide, is it coming? There are animations, ma'am.
Yeah, now actually I was not able to see the heading, Shweta. Now I'm able
Okay,
to.
okay, okay,
Yeah,
got it.
so that is why I had to remove that black bar which was coming.
Right, right.
Yeah, okay. So, starting with the session objectives and expected outcomes, today we will try to cover up the objectives as we will tell you, we will make you trained and learn about the sexually transmitted infections and RTIs, that is reproductive tract infections. Then I'll be taking up syndromic case management of STIs and RTIs, then counseling for prevention, treatment, and management of STIs and RTIs. With that, I expect the outcome of today's session to complete to discuss and define the importance of STI RTI screening and management, explain the syndromic case management of STIs and RTIs, and develop a counseling skills and strategies for the prevention and control of both. So coming to the first, that is sexually transmitted infections. So the sexually transmitted infections are those infections that are spread primarily through person to person via sexual contact. It can also be transmitted from an infective mother to her infant. So it is a very common situation that a, a person may have STI but does not have any symptoms. And more than 50% of the cases of all the sexually transmitted infections are asymptomatic. So this is very important point to be kept in mind that the patient, more than 50% of the cases of STIs are usually asymptomatic. A person may be infected with more than one STI at a particular time. And HIV can also be transmitted through sexual route and is an STI. So, working in the HIV program, we tend to forget that HIV is also a part of a sexually transmitted infection, and it is important to keep ourselves reminding the same. So, coming to the reproductive tract infections. Now, reproductive tract infection refer to any infection of the reproductive tract. So in females, it can be an infection of vagina, cervix, uterus, fallopian tubes, and or ovaries, and it may also involve external genitalia. In males, it can be infection of testes, scrotum, and or prostate, and may also involve external genitalia. Now, some RTI may spread in the same way as STI, but a reproductive tract infection can also be due to overgrowth of normal organisms in the reproductive tract. Now, there are certain practices, for example, douching, then having multiple sexual partners, and inconsistent condom use that can also be associated with RTI. So, a point that needs to be kept in mind is that reproductive tract infection is different from an STI. An STI can lead to an RTI, but RTI by itself is a different thing. RTI does not lead to a may not does not lead to STI. So this is an important point to be kept in mind. Now coming to the epidemiology of STI and RTI, estimated annual STI prevalence is 6% among the adult population in India, which is around 33 million STI episodes annually. 5% of women and 2.1% of men in the age group of 15 to 49 years who have had sexual intercourse have come for self-reporting the STI in the last 12 months. And this is as per the NFHS 5 survey. So, and it is to be noted that 12.3% females and 9.3% of the males, while self-reporting, showed the presence of STI symptoms in the form of genital discharge, sore, or ulcers. Now, another point which is of importance is that women living with HIV are more likely to develop persistent human papillomavirus infection at an earlier age. Also, women by itself rapidly progress to pre-cancer and cancer when they suffer from STI. And if the woman is infected with HIV, then the chances of development of cervical cancer increases 4 to 5 times. Now, what are the common causative agents of STIs and RTIs? So, causative agent can be viral, bacterial, protozoal, fungal, or parasitic. So viral are the HIV, genital herpes virus, genital herpes that is caused by HSV2, then the warts, that is genital warts by HPV, human papilloma virus, then hepatitis B and hepatitis C. So these are the common viral causative agents. Then coming to the bacterial, these are syphilis, gonorrhea, chlamydia, and bacterial vaginosis. Then protozoal, which is trichomoniasis. Then fungal, that is candidiasis. Then parasitic, for example, pubic lice and scabies. Now, what are the signs and symptoms of STI, RTI in men and women? So, among the men, the signs and symptoms could be urethral discharge, burning or pain during urination, increased frequency of urination, genital itching, swelling in the groin area or scrotal swelling, blisters or ulcers on penis, foreskin, urethral meatus, and urethra, or genital warts. Among the women, there can be an unusual discharge from vagina. There can be abnormal or heavy vaginal bleeding. There can be genital itching, pain while having sex, dyspareunia, lower abdominal pain, which is below the belly button and in the pelvic area. Then blisters or ulcers on internal, external genitals or genital warts. Now, the symptoms can be oral also when there is a history of oral sex. So that can be blisters or ulcers in mouth, tongue, and lips, sore throat, voice changes, difficulty in speaking, or even shortness of breath. And there can be generalized symptoms or presentation like fever, body ache, muscle pain, dark colored urine, and women may present with infertility also. Then there can be an anal or perineal area symptoms also, like anal discharge with history of receptive anal sex, blisters or ulcers on anus or surrounding area. Then there can be pain while passing stools, anal or perianal itching, or anal or perianal warts can be there. Then what is the relationship between STI and HIV infection? So this is very important that if a person has HIV, then the person is likely to have impaired immunity, which can definitely make the person more susceptible to any opportunistic infection, including STI, sexually transmitted infection. Also, if there is a high risk sexual behavior, then there is more chance of development of STI as well as HIV infection. So we can see that there is a direct relationship between STI and HIV infection. Now, getting into more details, the mode of transmission of both HIV infection and other STIs is the sexual route. So they both have a common mode of transmission, and so they can occur at the same time. They can be coexisting in in any patient who is suffering from HIV may also have an STI, and the presence of STI increases the risk of HIV transmission. How? So if so if so if the person has an STI, then that person will have 2 to 5 fold uh, then the person will have more so if the person has suppose a genital ulcer, then the chances of acquiring the infection will increase 2 to 9 folds. And if the person has a genital discharge, then in the discharge, the HIV viral load will be very high. So the person is likely to give more infection. And STIs are a marker for high risk behavior which lead to HIV infection. So obviously, if the person has an STI, that person may have a high risk background and which can definitely lead to more chances of the HIV infection. STI, RTI, and HIV positive people can increase the viral load and shedding of virus in the genital fluids. A higher viral load increases efficiency of HIV transmission risk to others. Management of STIs reduces the HIV transmission also. Now, coming to the syndromic case management, a public health approach to treatment that has been supported by the WHO. Healthcare providers use symptoms reported by the patient and observes the sign during the physical and internal examination to identify the syndrome affecting the patient and gives treatment for all infections. So this syndromic case management approach has been considered to be the backbone of many services of these services at DSRCs. A healthcare personnel may use the term as vaginal discharge syndrome or lower abdominal pain syndrome. Now, what are the advantages of this syndromic case management? So, advantages are that it is a fast way of managing the patient. That is, the patient is diagnosed on the basis of the symptoms and treated in one go at the same visit. It is highly effective for selected syndromes. Then it is relatively inexpensive, scientifically tested, easy to learn and practice, easy integration into primary healthcare systems, and it has its standardized treatment regimes. Now, there are certain limitations also of this kind of syndromic case management. That is, it is not useful in asymptomatic patients because asymptomatic patient will not be able to tell us the symptoms on which the whole syndromic case management is based on. So, over treatment, if the patient has only one STI and that causes a syndrome, because it is basically the kids or the management part is on the basis of the syndrome. So it may be so that the infection is only one, but it may be over treating the patient, and then increase chances for development of antibiotic resistance because of the overtreatment. Now, most common STI RTI syndrome in women include vaginal discharge, which can be because of trichomoniasis, candidiasis, bacterial vaginosis, cervical discharge, gonorrhea, chlamydia, trichomoniasis, herpes simplex, lower abdominal pain, which can be because of gonorrhea, chlamydia, mycoplasma, Gardnerella, and aerobic bacteria. Then there can be anorectal discharge because of gonorrhea and chlamydia. Then throat irritation because of gonorrhea and chlamydia. Then genital skin conditions, which can be genital warts, molluscum contagiosum, pediculosis pubis, scabies. Then among the men, there can be urethral discharge, which is because of trichomoniasis, gonorrhea, chlamydia, genital ulcers, which will cause genital discharge, genital ulcers, which can be because of chancroid, syphilis, and genital herpes. Then inguinal bubo, which can be because of lymphogranuloma, venereum, and chancroid. Then anorectal discharge because of gonorrhea and chlamydia, scrotal swelling because of gonorrhea and chlamydia, and genital skin conditions because of genital warts, molluscum contagiosum, pediculosis pubis, scabies. Now, this is the syndromic case management that is being followed. So it has 8 kits total. The first kit is kit 1, which is gray. So it has azithromycin and cefixime, and it is the targeted syndrome for this is the urethral discharge syndrome, vaginal discharge syndrome for cervicitis, then painful scrotal swelling and presumptive treatment. Then the another kit is kit 2, which is green. It is because it is for the vaginal discharge syndrome for vaginitis, in which we have secnidazole 2000 mg and fluconazole 150 mg single dose. Then the third kit is white, which is for the genital ulcer disease syndrome for syphilis and chancroid. And this kit has benzathine penicillin and azithromycin. So the person who is allergic to benzathine penicillin is given kit 4, which is blue. And this one has doxycycline and azithromycin, and it is for the same targeted syndrome as kit 3, that is genital ulcer disease syndrome for syphilis and chancroid. Then is the kit 5, which is red, which has acyclovir, and it is for the herpetic ulcers. Then is kit number 6, which has cefixime, metronidazole, and doxycycline. And this one is for lower abdominal pain and PID. Then we have kit number 7, which is black in color, and it has doxycycline. And this one is for inguinal bubo and lymphogranuloma venereum proctitis under anorectal discharge syndrome. And then last is kit 8, which is brown, and this has cefixime and doxy, and this is also for the anorectal discharge syndrome. So these are the 8 kits which are available. Now, in this syndromic case management and STI management, it is very important to treat the partner, otherwise the infection will not go away. So partner notification and management is the very important part of counseling also, and management of the patient for the STI. So it is very important that partner notification and management is done while maintaining the confidentiality. The patients on treatment for STI, RTI must be encouraged to bring in their sexual partners for screening and management of STI. Partner notification and treatment is needed even if the partner does not show any symptoms, because as discussed before, 50% or more even the STIs do not have any symptoms. So it is very important that the partner has to be brought even if the partner says that they do not have any symptoms. Now, two approaches to partner management are: either the clients can be counseled about talking to their partners on their own, so they can directly explain the partners about the STI and need for getting the treatment. Then is by motivating and accompanying the partners to the treatment center. Then asking the partner to attend the clinic without specifying the reasons. Providing referral card to the partners and asking him or her to attend the clinic. Then also there is another approach wherein the providers can tell the partners in conjunction with the client. So we can tell the client that we can be on board to explain the partner about the STI. Now, important consideration for management of STI RTI includes educating and counseling the client and sexual partners regarding STI RTI, safer sex practices, and importance of taking the complete treatment. Because if they do not complete the treatment, then there will be a relapse of the infection and the infection will not get treated. So it is very important to educate them about these things. Then sexually active female HIV will have to be screened for STI and RTI regularly. Then treat the partners, very important. Advise abstinence or use of condoms. Provide condoms, educate about correct and consistent use. And any STI patient has to be referred to the ICTC for the testing of the HIV. Then follow up after 7 days for all STI, third, 7th, and 14th day for LAP, and 7th, 14th, and 21st day for inguinal bubo. Then consider immunization against hepatitis B and also hepatitis A and human papilloma virus. Now, counseling for STI and RTI also include these. This is a table which shows that what all should be included while counseling the patient for STI or RTI. So, information about STI and RTI should be given to patient, wherein we should tell about the basics of STI and RTI, then how does it spread, modes and risk of transmission, then range of symptoms, details about asymptomatic infections also, then consequences and complications, that what all can it lead to. Then link with HIV infection, that how is STI linked with HIV and why it is important to get yourself tested for HIV. And if you are positive, then obviously linking to the ART centers. Then information, screening and management of STI and RTI. So methods of screening and diagnosis should be told to them. Appropriate treatment and treatment adherence has to be reinforced for proper management. Then importance of follow-up and detailed information on the follow-up plan should be given. Details on reinfection, persistent infection, and treatment failure. So these details has to be given to the patient so that timely action can be taken and the STI or the RTI can be managed. Then importance of partner notification and management of the patient as well as the partner if required. Information on strategies for prevention of STI and RTI. So tailor-made risk reduction strategies has to be made as per the client. Correct and consistent use of condoms should be reinforced and told about. Condom negotiation skills, so it should be very important that the partner, that the client should be told that they have to use the condoms and make it a necessity in order to prevent the STI. Then safer sex practices has to be reinforced. Then pre-exposure prophylaxis and post-exposure prophylaxis for HIV infection, that information has to be given to the client. And post-exposure prophylaxis for STI information should also be given. So doxycycline is the drug that is being given for the post-exposure prophylaxis for STI patients. So that information has to be told to them. And for the high-risk group where it can be, where it may be required, that they can use it then. And then vaccination, again, they should be told about the prevention strategy, including the vaccination also, where they can take the vaccination for hepatitis A, B, and human papilloma virus. So these are the few case scenarios that, that can be discussed. The first is that a woman comes to the hospital with a complaint of vaginal discharge, which is foul odor for the last 2 weeks. So it's a foul odor discharge. So is it a STI or an RTI or a RTI? So this is likely to be STI. What could be the reason for the symptom? It could be because of uh, the multiple partners and because the partner is infected, maybe that is the reason. So it is a sexually transmitted infection. How will you proceed for the management of the case? So in this case also, we will also follow the syndromic case management. And so you can see that it is the vaginal discharge. So we will be giving kit 1 gray in this case, which has azithromycin and cefixime. And also, if we want to particularly say that which is the organism which is causing this, so vaginal discharge with a foul odor is likely to be bacterial vaginosis. Now, as a part of the syndromic case management, we will definitely give kit 1, that is the gray kit. What will be your focus of counseling for this patient? So definitely we will discuss, we will tell the patient about all the things that we have discussed here. So we will tell about the basics of STI and RTI modes of infection, then what is the importance of getting your partner for the treatment, then how you have to be adherent and follow up, and then also about the safe sex practices. And because if the patient is having multiple sexual partners, then we can tell them about the vaccination part also. And also we will get the HIV testing also done of the patient, of the client. So, what will be your advice on follow-up for this client? So, we'll definitely ask the patient to follow up for the in the 7 days. How will you ensure partner notification and management? So that we have discussed before. First, we will tell the client if that client is willing for partner notification by themselves, or even the healthcare personnel can come on board and help with that. And also, if the partner is asymptomatic, that does not mean that the partner does not have infection. So we will have to give the kit to the partner as well and get that person treated. Then this is the second case scenario in which a man comes to the hospital with the complaint of discharge from the penis. Now, is it a RTI or RTI? Is it STI or RTI? So this is also likely to be STI. What could be the reason for the discharge? So the reason could be anything from trichomoniasis, gonorrhea to chlamydia. How will you proceed with the management of this case? So in this case also we will have to give a syndromic case management, including the partner notification and everything that we have discussed before. And in this case also we will be giving the first kit, that is the kit number 1, that is gray. And what will be your core focus for counseling of this patient? So core focus would be to have safe sex practices, to follow up, to take the treatment properly, to get the HIV testing done. And if the patient, so basically all the information, including the vaccination part, has to be given to the patient. And how will you ensure partner notification and management? So that would be the same thing, that we will encourage the client to do it, and also we can help the client in the same. So a young man comes to the hospital with the complaints of discharge from the anal opening and difficulty in passing stools. So is it a STI or RTI? So if you can see that this can be a lymphogranuloma venereum, kit number 7, if you can see here. So this can be the case when the patient may be having LGV proctitis, because of which there can be a stricture formation, and that is why the patient is having a pain while passing the stools. So in this, we can give kit 7, which is black. This is a doxycycline. So this now this anorectal discharge so basically what will be the plan of counseling? The counseling would be very same. We will be telling about all the safe sex practices, partner notification, and everything that we have discussed with patient. However, in this case, we will ask the patient to come uh, little frequently. So the patient will be coming on 3rd day, 7th day, and 14th day for the follow-up. And how will you ensure partner notification and management in this case? That would be the very same like any other STI. So now this is the case number 4. That is a young boy presents with a history of protected sexual encounter 3 months back. He mentions of great distress and fear of acquiring STI during that encounter. What will be your line of action for this boy? And how will you counsel this boy? So because the boy had a protected sexual intercourse or encounter 3 months back, it is likely that the patient will not have an STI. However, we will have to still screen the child for the same, the patient for the same. And in this situation, the most important part is the counseling. where we have to tell the child about the abstinence or safe sex practices, and we have to tell the child about we have to take the detailed history and find out if that patient belongs to any high risk group. And with that in mind, we have to do the counseling and tell all the details from the basics of STI to everything regarding it, and also about HIV and everything. So, this is the case number 5 now, in which a lady complains of greenish vaginal discharge, and she has visited an obsgyne doctor and was diagnosed with, uh, basically, she has been diagnosed with an RTI. She is afraid to inform her husband about the same for the management, and she believes he would question her behavior and that their marriage will end. So, what could be the possible reason for the discharge, and what would be the line of management? So, this in this case, the patient is having a RTI, and another important thing is that how will you encourage her to tell her spouse? So in this case, I think the most important thing is her worry that how would she disclose it to her partner. So this is an important thing that maybe a doctor can help her with the same, because she may not be able to put that across so well um, to the husband. And it will be better that a doctor can be on board and tell that an RTI can also be because of the overgrowth of the normal organisms, which are microorganisms which are present. So this way, her marriage can be saved, and she will not have to go through that problem. Now, another important thing is that the greenish vaginal discharge can be because of it can be because of bacterial vaginosis, trichomoniasis, and other STIs. So, it is important that the spouse is called on board, is screened and checked for the STI, because STI by itself can also lead to RTI. So, that is very important that we call the spouse also and manage the spouse also on the same. So, how will you assist her in disclosing her RTI and encourage her spouse to seek treatment, that we have discussed? So, we can definitely tell about all the scenarios where how an RTI can be um, caused. Now, an adolescent boy calls 1097 and says of having sores around his penis, and he's afraid of the sores. So, what could be the possible reason of these symptoms? So, because he has genital sores, it can be because of chancroid, it can be because of um, genital herpes. So, how will you encourage this client to seek STI services? By telling about the basics of the STI, by telling about what all can be the complications later, and why is it important. So basically counseling the patient. What are the important points to cover in his counseling that we have discussed before also in this table? That basics of STI and RTI, different modes of transmission, what are the symptoms, consequences, complications, then different why is it important to be adherent to treatment. Then basically we'll be doing all the counseling about that, and also about the correct and consistent use of condom and safe sex practices, and about the post exposure prophylaxis in future, everything. So how will you ensure partner notification and management? So that we have again discussed that we will tell him about why it is important for the partner to get treated, and how it can be done. And then managing, even if the partner is asymptomatic, then also we need to manage, we have to treat the partner as well and manage the case. Now, coming to another topic, that is syphilis. So, syphilis is a sexually transmitted infection which is caused by a bacterial spirochete, Treponema pallidum. Now, there are three stages in syphilis. First is the primary syphilis, which is a painless ulcer, which lasts for 2 to 6 weeks, and it can heal without treatment. So, important point is that in primary stage, the patient may not come to us because the ulcer is painless, so it is not causing much problem to the patient, and it may heal by itself without treatment. So the patient may feel that that there is no problem now, so the patient may not report to us. Now, after this primary syphilis stage, the second stage is secondary syphilis. The secondary syphilis is the stage which is in which the most common symptom is skin rashes all over the body, which may be associated with fever and muscle pain. So this is the stage when the bacteria is circulating in the blood, and it is causing infection to all the other organs. And this is also a stage which lasts for 2 to 6 weeks. After this, the third stage is the tertiary syphilis, which occurs after several years of infection. So this stage can be manifested in the. You may see a complicated case now, which in which the brain or the spinal cord may be infected, causing neurosyphilis. The aorta and the heart may be infected, causing cardiovascular syphilis, or it may just go into the late benign syphilis. So there are serological tests for syphilis. There are two types of serological tests for syphilis. One is the treponemal test and the other one is non-treponemal test. Treponemal tests are the tests which are directly detecting the antibodies against Treponema pallidum proteins. And non-treponemal tests are the tests which detect antibodies against lipoidal agents, antigens, and damaged cell. So this is an important point to be kept here. And in the treponemal test, there are two tests. One is TPHA, that is Treponema pallidum heme agglutination assay, and the other one is TPPA, which is Treponema pallidum particle agglutination. In the non-treponemal test, we have rapid plasma reagent and VDRL test. Now, both these tests are used. So both treponemal and non-treponemal tests are used to screen or confirm the infection and determine whether the disease is active or not. Both treponemal and non-treponemal tests may remain positive even when even when the disease is inactive or has been treated, and even throughout the life. So majority of rapid tests includes dual RDT kits for the syphilis. For syphilis are treponemal test. So basically the rapid test kits that are available are mostly the treponemal test kits. Now this is the diagnostic algorithm that is followed. So if the screening is done with the treponemal test, then the confirmation is done by a non-treponemal test. If the screening is done by non-treponemal test, then the confirmation is done by the treponemal test. So it can be used vice versa. So RPR is the screening test, but is a confirmatory test when screening test is dual RDT kits. Now, RPR titer value is important for treatment monitoring for treatment monitoring of the patient, and RPR titers, if repeated after 3 months of the treatment, RPR titers should be repeated after 3 months of the treatment to check if the treatment is successful or not. Now, if these titers are stagnant or increasing after 3 months of treatment, then we have to suspect a treatment failure. Patient can be treated with injection benzathine penicillin G or kit 3 or kit 4 as per the stage of the syphilis. Now, in case of neurosyphilis, the benzathine penicillin 4-MU IV 6 hourly is given for 10 to 14 days. And if so basically in pregnancy, if the mother's titers are reactive at delivery, then check the infant's titers and compare them with the mother's. So if the titers are higher than the mother, then this is an indication that the infant is infected and definitely needs a treatment and a workup for congenital syphilis. Now, it is very important to have a coordination among facilities and STI services. So coordination among facilities and STI services for sex workers, MSM, transsexual and transgender and IDUs are. So as a part of the differentiated prevention strategies of the TI program, quarterly screening or quarterly routine medical checkups is highly promoted among the core groups. Then referral is made to DSRC and camp-based approach for STI in prioritized hotspots or population where there are high priority, high risk groups. TIs are currently providing referrals and linkages with various other facilities for the treatment of STI and syphilis. Then there are inter-referrals which have been promoted between DSRC, Sampoorn Suraksha Clinic, ART centers, and TI programs for STI, HIV, and syphilis testing and monitoring. Now, clinical management of STI, RTI high-risk group. So, effective prevention and treatment of both symptomatic and asymptomatic STI, RTI among the core groups is important. We do treatment of symptomatic infection and we do screening and treatment of asymptomatic infections. So as per the national guidelines, regular medical checkups at least once in every 3 months is done, and prophylactic therapy for asymptomatic gonococcal and chlamydial infection is given, which is administered only to sex workers, MSM, transsexual, transgender during their first clinic visit, and repeated only if no regular checkup has been done for 6 months consecutively. Biannual serological screening for syphilis is done among the high-risk groups. Now, this is a quiz just to brainstorm and just to revise what we have done. So one important thing is non-penetrative. So this is true or false. So non-penetrative sex minimizes the risk for STIs. Well, non-penetrative definitely reduces the risk for the STI, but it does not eliminate it completely because still there can be a sexual transmitted infections that can occur. Condoms, both male and female, are the best method available to prevent the transmission of STI to sexually active people. Yes, that's right. Condoms are one of the best methods which are available for the same. Then pre-exposure prophylaxis, also known as PrEP, helps prevent transmission of STI. Now, coming to the pre-exposure prophylaxis, that is for the HIV, and HIV is an STI, is a STI. So definitely pre-exposure prophylaxis can be given to a partner who is exposed to an HIV positive person, and it can help. Every sexually active person with multiple partners must be screened regularly for syphilis. Well, that's true. If the person has a high risk behavior, then the person should be definitely regularly screened for syphilis. NACO provides 8 color-coded kits for STI medicines and syndromic case management. Well, that's right. And we have discussed this also, that there are 8 color-coded kits that are available for the STI. Now, this is a summary that STI and RTI are infections that affect the reproductive tract, but STI spread through the sexual contact, while RTI can also be caused by overgrowth of normal organisms or improper medical procedures. STI and RTI can increase the risk of HIV transmission and acquisition, alter the natural history and manifestations of HIV infection, and affect the success of ART treatment also. STI and RTI can be prevented and treated by safe sex practices, hygiene screening, diagnosis, counseling, and medication. STI RTI are a major public health problem that can cause serious complications and increase the risk of HIV transmission. STI RTI can present with various signs and symptoms such as genital discharge, ulcers, warts, pain, itching, fever, etc. Some STI RTI may be asymptomatic and they may require screening and diagnosis. Now, STI RTI management can be done by 3 approaches: traditional, clinical, syndromic approach that we have discussed, or lab assisted, which may differ in way of identifying and treating the infections. Syphilis can be diagnosed and treated by using serological test, that is treponemal or non-treponemal test that we have discussed, and penicillin injections, which depends on the stage of the infection and patient's allergy status. So this is the app that you can use for the treatment guideline of the HIV. So thank you. And you can scan the QR code if you want for the same.
Thank you so much, ma'am, for facilitating this important session. Any questions from the participants? Please feel free to unmute. Ma'am, sorry, there's a gazetted holiday for Haryana and Punjab today, so the
Oh, okay.
attendance is less.
No
Sorry if
problem.
you were not aware of it. And we have made a note. I have also requested Rajni ma'am to make a note
Okay.
of it, and next year we'll plan accordingly.
Okay. Okay. No problem.
Any questions from the participants? Ma'am, I don't think there are any questions. Thank you so much
Okay.
for facilitating this session.
Okay. Thank you.
Thank you to all the participants for patient listening. We'll conclude the session now. Oh, sorry. Yeah, requesting all the participants to please attempt the feedback poll. There are 5 questions in all, requesting all participants to scroll through the 5 questions and click on the answer of your choice. Please do not leave the meeting without attending the feedback poll. Please take a minute to attempt the feedback poll. Requesting all the participants to please attempt the feedback poll. Yes, we can end the feedback poll now. Thank you everyone for participating and patient listening. We'll conclude the session now.